everyone. Thank you so much for joining us this evening. I am Amanda. I'm a medical esthetician and laser technician here at Dermatouch San Antonio. And I am going to be highlighting two of my favorite treatments, Sciton's BBL and MOXI. It's my favorite time of year. It's laser season. So I'm thrilled to be talking about these two wonderful treatments with you today. Please feel free to submit any questions that you may have through the questions tab. We will have a live Q&A at the end of this presentation, so please stay tuned. For our laser season promo, we're offering 10% off BBL and MOXI treatments. This can be a BBL series, a MOXI series, or a BBL MOXI combo. In addition to that, you'll receive an Even Correct serum from SkinMedica. This product is going to help enhance your results as you go through treatment, and it's a $178 value. In addition to that, anyone that schedules a complimentary consultation through the end of November is going to be entered into a drawing to win a $500 gift card to a hotel. What a great way to celebrate this fall. And one lucky winner tonight is going to win a complimentary BBL MOXI combo. How exciting! We've also got some really great giveaways for you tonight. One lucky viewer tonight is going to win a MOXI treatment. It's so exciting. Let's talk BBL. BBL has been one of my favorite treatments since I started in medical aesthetics 13 years ago. That just tells you how amazing this technology is. So BBL stands for broadband light, okay? It is a light treatment, it's not a laser. And what we do is we use different wavelengths of light to target different issues within the skin. This is wonderful for reversing sun damage, addressing brown spots or blood vessels. It's also a really beautiful treatment for anyone that struggles with rosacea or flushing. Using a very specific protocol, it's called the Forever Young BBL protocol, we can actually change the gene expression of our skin cells. So guess what, guys? If our skin cells start to behave in a more youthful way, you can physically see it. You look younger, hence the name Forever Young BBL. Now that is a published Stanford study, so if you are interested, you can go online and read all about it. It is fascinating. Minimal to no downtime is required after BBL, although you should expect your brown spots to get a little worse before they get better. That pigmentation is going to climb up the layers of your skin and slough off within about 5 to 7 days after your treatment. Makeup following BBL is perfectly fine, so if you do need to cover that darkened pigmentation for a few days, that's perfectly okay to do so. Again, BBL has been one of my favorite treatments since I started in medical aesthetics. I truly believe in this technology and I routinely recommend it to my patients. So MOXI is a newer technology from Sciton. It's a non-ablative superficial laser resurfacing treatment. With this, we're able to address issues like sun damage, texture, fine lines and wrinkles. It really is a great way to address the early signs of aging. So with this treatment, we'll apply a topical numbing to the treatment area. The treatment itself is rather quick. It's done within just a few minutes. Now afterwards, when that numbing wears off, most patients describe it as feeling like a sunburn sensation. That heat will continue to leave the skin the hours following the treatment. Because MOXI targets water within our skin cells, it creates micro injuries to the tissue. So what that means is after the treatment, the texture of the skin is going to feel very rough. You're going to slough that skin over 5 to 7 days after the treatment, and you'll be left with this beautiful, even-toned, radiant skin. It really is a gentle way to revitalize your skin. So here's the really cool part. These two modalities can be combined and done in the same treatment. This is going to maximize your results, addressing multiple issues simultaneously. MOXI is going to refresh the surface of the skin, whereas BBL is going to address photo damage, pigmentation, and redness. It really is a comprehensive approach to skin rejuvenation. These treatments are great for anyone that is seeing the early signs of aging, anyone that has sun damage, brown spots, redness, is concerned with tone or texture of the skin. These treatments require minimal downtime, so they're easily worked into your schedule. Optimal results after these treatments are typically visible 1 week after treatment, 2 weeks for the body. I always recommend doing 4 BBL treatments a year, and that's referencing that Stanford study that we talked about earlier. We know at that frequency we're getting the gene expression change, so try to get those 4 treatments in a year. Now, BBL does require that you avoid the sun before and after your treatment, so if that's challenging for you through our sunnier months, we can target those, we can focus those treatments during laser season. With MOXI, it varies a little bit on my recommendation there, depending on the age of the patient and the severity of sun damage and other concerns. But typically I recommend 3 to 4 treatments a year of MOXI. Thank you all so much for joining me this evening for the Skin Rejuvenation event. I hope you learned something. I encourage you all to check your text messages following the event and get that complimentary consultation appointment scheduled to get entered into the drawing for the $500 hotel gift card. I will be available for the next 10 to 15 minutes to answer any questions that you may have, so feel free to continue to submit those through the question tab there. Thank you again for joining me, and I will be reaching out to our lucky winners soon. Thank you. Good night. Hello everyone, Amanda here. Thank you again for joining me this evening. I'm seeing a lot of familiar names coming through the question box here, so thank you. I will address each of these. If we do happen to run out of time, don't worry, I will get back to you and get all of your questions answered. So first one I'm seeing here is, are either of these treatments good? Common concern, especially here in San Antonio. Melasma is treated very differently than sun-induced pigmentation or age-induced pigmentation. Oftentimes, melasma can be triggered by heat and light, actually. So BBL is not a great treatment option for melasma. Now, MOXI can be done with melasma. However, we take the slow and low approach. We treat very conservatively and just knowing that we will have to do more treatments in the long run to get to our result. The other thing to understand about melasma is that it is chronic in nature. So once you have it, we can get it dormant or not hardly visible, but you have to be very diligent about sun protection. My recommendation with melasma is scheduling the complimentary consultation. That way we can take a look at your skin specifically and make the best recommendation. Oftentimes we will go the chemical peeling route for melasma, but great question. Let's see, what is better for someone who is over 40 with acne scarring? Great question. I do see this quite a lot. I love MOXI because of the resurfacing aspect to address the textural issues associated with acne scarring. So in that regard, my preference is, if it's textural, MOXI is a great choice. Now, if you have redness or erythema from the acne scarring, or even if you're left with some pigmented marks, BBL can address those as well. So sometimes it's a combination. And again, I would recommend doing the consultation, having your skin specifically analyzed, and we can make the best recommendation for you on that. What is the difference between MOXI and BBL? So BBL is a light treatment. Its main focus is treating pigment, sun damage, vascular lesions, and then of course addressing the gene expression change of the skin cells. Whereas MOXI is a non-ablative laser treatment. So they differ in that. One is light, one is laser, and it's really going to focus more on textural aspects of the skin, helping to improve fine lines and wrinkles, pore size. All right, scheduling consultations is very easy. That can actually be done through our app. You can do it all virtually, or you can give us a call and we can help you get that scheduled. All of our consultations are complimentary. And I do want to remind you that if you do come in for the consultation before the end of November, you will be entered into that drawing for the $500 gift card for the hotel getaway. So great time to come in and do it. And plus it's laser season. So it's a really ideal time of year for us to do these treatments. Let's see. Does it help if I have skin discoloration? Again, that pigmentation or discoloration, really we need to find the source of it. So if it's hormone-induced pigmentation, BBL is probably not the best choice, but we do have some great options there. If it is pigmentation caused by sun damage or just the aging process, BBL is a wonderful choice for it. Timing, how long does an appointment take? So that varies a little bit depending on the area that we're treating. Generally for a BBL, I would plan on being in the office anywhere from 30 minutes to an hour. For MOXI, because it does require numbing, that appointment is a little bit longer. I would plan for about an hour, hour and a half on that one. But again, if it's your first time into our office, we are going to take the time to do that complimentary VisiaSkin analysis with you to really take a deep dive into the skin and make sure that we're making the right recommendations for you and your concerns. As someone who has a reaction to BBL, is MOXI something I can do? Well, I would need to get a little bit more info before I can answer this one regarding the reaction to the BBL and what may be causing that. So I will reach out to you directly and we will have a further conversation on this one. Is there a way to start with BBL only? Yes, absolutely. So while these two treatments or modalities complement each other beautifully, they can be done separately. And if there is a concern, if, regarding reaction, I do typically recommend separating the two. We do a BBL first. And then as we know that you're tolerating that well and getting the results that we're looking for, we can always add the MOXI onto the treatment later. Again, MOXI also can be done just alone, standalone. It does not have to be combined with BBL. So on those patients that do struggle with melasma, just doing the single MOXI treatment at a low setting is appropriate there. Can these be done on the neck? Absolutely. I love treating off of the face with both of these treatments as well. These can be done on the body, the neck, the chest, the hands are extremely common treatment areas for us. If I wanted to do a combination of MOXI and BBL laser, what is the interim time in between each treatment? Great question. So frequency on these, I like once a month. That was what I can kind of consider a correction phase. Once we get to the skin in a good condition, then we typically back off and go to quarterly treatments. Again, I always recommend doing 4 BBL sessions a year, and that's referencing that 10-year Stanford study. We know at that frequency we're getting that gene expression change, and that's a really important component to this treatment. Let's see what else we have here. Some of these are in Spanish. You guys are really testing me here. What is the best option for pores? I feel like even though I see some really beautiful improvements in the texture of the skin with BBL, MOXI is probably a better fit for addressing pore size. We also have a couple other treatment options in the office that can help with pore size as well. But if that's your main focus, I would probably go the MOXI route. Can these be done in the eye area? This is also a really great question. So eye area is tricky. It's very thin skin there, and obviously it's very sensitive being that close to the eye. So the rule of thumb on this is that we have to stay outside the orbital rim, which means we have to be over the bone. Now, a lot of times what we are able to do is use the protective eyewear, but pull the tissue down slightly and get a little bit closer to that under eye area very safely. Okay, here's a good one. When we say you need to avoid the sun, how long before and after the treatment? So recommendation is at least 2 weeks before and 2 weeks after of no direct sunlight for 30 minutes or longer. So that's your 1 month right there, which is why I mentioned a lot of times what we will do is focus these treatments during laser season. Our fall and winter months the sun is not nearly as intense. We have had some time for the pigment to lessen that we acquired over the summer. So it is the ideal time to treat with these. A lot of my patients are really diligent about sun protection and do a good job year round, and we're able to safely treat year round. So that rule of thumb is not for everyone. It depends on you and your lifestyle. Medical contraindications for undergoing these treatments. Yes, there are. Because BBL is a light-based treatment, it's a very bright flash of light. If you are prone to seizures, it is not recommended that you do BBL. We also do not take or treat pregnant women. It just hasn't been studied to be proven safe. So it is best to wait until after delivery before you start treatment. So as a reminder, you guys are going to be receiving a text message at the end of the event. Just please reply with special so that we can contact you to get that consultation appointment scheduled. And then as also a reminder, we have our laser season promos, and a lot of names I see on here are already members with us. This is one of the rare promos that we run where it's in addition to the discounted membership price. So it's a great time to take advantage of these if you're considering it. We've got 10% off of the BBL package, 10% off the MOXI package, and 10% off BBL MOXI combo treatment. In addition to that, you're going to receive the Even and Correct from Skin Medica. This product is phenomenal for addressing that pigmentation. What I really like about this is that it's not a bleaching agent. So many products out there that address pigmentation are contain bleaching agents. This one actually works differently. It works to disrupt the melanosis cycle of the skin cell. So that skin cell is going to want to produce melanin or pigmentation. And this product is just going to say, hey, you don't need to do that. Stop doing that. And so it's really more preventative than corrective. So really great product, complements these treatments beautifully. The other promo we have going for laser season right now is on hair removal. So if you're interested in that, reach out to us so we can go over all that with you as well. And then let's see, again, the $500 hotel giveaway. Don't forget about that. Get your consultation scheduled before the end of November to get entered for that. How old is too old for these procedures? So I have been performing this treatment BBL for 13 years now, and I have treated everyone from their 20s to their 90s. So you are never too old for this treatment. I actually have a couple regulars in their 80s and 90s that will come in and still see really beautiful results with these. So Never too late. Let's see what else we have here. How do I know if I'm a good candidate? So that, again, I would recommend doing the complimentary consultation. During that visit, we're going to do a full Visioskin analysis with you, really analyze the skin, and address your concerns specifically. It's different for everyone, right? We all have that one thing that just bugs us. So that looks different for everyone. And during that, we'll be able to make recommendations on the correct treatment for you and your concern. The 10% is the 10% on top of the membership discount. It absolutely is. So you would get your membership discount. We would take the additional 10% off of that, and then you would also receive the even and correct product. The laser season promos will be ending at the end of November. So you would just need to purchase and schedule before the end of November to take advantage of those. Really good questions, you guys. See, I think we're tapering off here a little bit. Let me see if I had some others that were pretty common. Oh, BBL and IPL. I get this a lot. Is BBL the same thing as an IPL? And the answer is actually yes. BBL is a brand, if you will, of IPL, intense pulse light treatment. In my opinion, BBL is by far the most effective IPL device. It's the most studied IPL device on the market. So if you're looking at IPL treatments, make sure you go the BBL route. I think it's well worth it. And let's see. How many treatments does it take to see results? This is a good one. Most of my patients, I would say 99% of my patients see improvement just after the first treatment. And a lot of times, especially with BBL, the pigmentation that rises up and sloughs off of the skin is very dramatic after that first treatment because you've got the most damage at that point. As we get into the treatments more, you'll see that taper off a little bit, but you're still getting the benefit of the gene expression change and just rejuvenating the skin overall. Is it okay to use retinol between treatments? Great question. Yes, it is okay to use retinol in between treatments. My rule of thumb is that you should stop retinols and acids about 5 days before you come in for treatment. So just think about that when you're scheduling and make sure you discontinue those types of products before we treat. Make sure I don't miss any of these. A lot of duplicates, a lot of questions about melasma. Let's see. Is it permanent? Yes, another really good one here. So results, improvement in the skin, yes, it is permanent. However, the aging process is continuing and you have underlying damage that you've collected over your lifetime that will continue to climb up the layers of the skin and become visible. So for that reason, we do recommend yearly treatments, ideally 4 BBL treatments a year, and then anywhere from 2 to 4 MOXI treatments a year, depending on the severity and the age of the patient. Someone's complimenting, saying that they've had BBL treatments and they have had amazing results with evening out the pigmentation and minimizing freckles. So yes, absolutely. It's perfect for that. Okay, I'm not really seeing anything else new here. Let me see if I had any others that I often get asked. Is MOXI like a CO2 laser? So a CO2 laser generally is an ablative laser, whereas MOXI is non-ablative, meaning we leave the skin intact And then you slough that skin over a series of days after the treatment. So you're not left open. You don't have that significant downtime like you would with a CO2 laser. And it's actually a diode laser, the MOXI is. So they are different. Yeah. I've touched on all of the questions. I just want to remind everyone that we are doing the giveaways. I will be reaching out to you, to 3 lucky winners. We're giving away a MOXI treatment, a $250 Dermatouch gift card, and then a HA5 hydrocollagen. And I will touch on this again because I am absolutely in love with this product. If you have not used this before, I highly encourage you to take a look at it. This is the newest launch from SkinMedica. They revamped the original HA5. They made this product a lot more tolerable for everyone, but they've also added collagen in. So you get this really beautiful plumping of the skin. It just looks very supple and very healthy. So love, love, love this. And someone's going to win it. And make sure I didn't miss any other ones coming through. No, I think we got everyone. I will reach out to that one that had a specific question to address that with you individually. But I really appreciate everyone for joining me this evening. If you have more questions, feel free to reach out to me. I'm always here. I'm always available. And get your consultation appointment scheduled. It's a complimentary visit. So why not get more information about these awesome treatments and get entered into that hotel giveaway. All right, guys, have a great evening. Thanks again for joining me. Talk to you soon. Bye-bye.